The economics have many different aspects, as you can imagine. So there's the upfront cost of just simply the tools we use. So they're frequently disposable items. They kind of add up in terms of your overall expenditure for that procedure. Clearly, room and labor costs are important for the duration of the procedure, et cetera. And then you include, in terms of the hospital stay, recovery time, and those kinds of things. So that's kind of the upfront way we look at it. And there are forces to varying degrees, pressures in terms of, well, you need to use these catheters rather than these others. There's some hospitals that have a reuse program, so some of the catheters are sterilized and reused. Others don't do that. So there's a variation in terms of the practice of how a lot of the different technologies are utilized. There's also certain base requirements. You need a certain kind of capital piece of equipment, and so you need to justify that, yes, we're going to do enough procedures to warrant that, and so that also is part of the economic discussion. Now, there's a broader issue that comes up as healthcare changes and it's pay for performance and things like that. So one then has to factor in success. And so you have to say, well, oh, okay, if we're paying for performance in terms of the number of medications they're going to need in the future hospitalizations, one might pay more to have a higher success rate initially in the procedure because downstream you're going to recover that. So there's a lot of complex interactions in terms of cost and how it might affect the overall patient's expenditures. The processes, I think, for good and bad, has gotten more, I think, typically formalized. In the old days, it would have been easier to just bring something in and start using it, et cetera. But typically, most hospitals have now a formal process where you add something to the various pieces of equipment that you can use. It's very similar to what's done for medications for a number of years. It's like the formulary for medications. There's a similar kind of list of different types of equipment that you can, in fact, even disposables that you need to have go through a process.